Hello, we are the Biomedical Science Students Association of McNeil High School, and today we'll be discussing a rare muscular system condition called polymyositis. Polymyositis is an inflammatory disease that targets muscles, causing severe muscle weakness and damage to muscle tissue. The exact causes behind polymyositis are unknown, but patients with certain other autoimmune diseases, such as rheumatoid arthritis, are at a higher risk of developing polymyositis. Polymyositis is believed to likely be an autoimmune disorder that is possibly triggered by a viral infection affecting muscle tissue. The word autoimmune refers to cases in which patients' immune systems begin to target friendly tissue, often causing irreversible damage to connective and skeletal muscles. Some well-known examples of autoimmune conditions are rheumatoid arthritis, systemic lupus erythematosus, or lupus for short, and multiple sclerosis. For patients with polymyositis, muscle tissues and the blood vessels around them become inflamed, causing muscle weakness and, in some cases, muscle pain. Oftentimes, the muscles near the trunk of the body, such as those found in the hips and shoulders, are first affected and cause the patient to progressively develop fatigue over the course of 3 to 6 months. For some patients, the fatigue develops suddenly, though this is a rare occurrence. Because of this fatigue, patients begin to have difficulty moving, such as getting up from seats, going upstairs, lifting objects, or getting up after lying down. Patients may also have trouble swallowing or develop rashes around the eyes. Shortness of breath, tenderness around certain muscles, and body tremors are some other common symptoms. Polymyositis is usually diagnosed using one or more of the following tests, prescribed and performed by health professionals: blood tests, magnetic resonance imagery or MRIs, electromyography, and muscle biopsies. Blood tests examine blood plasma for elevated blood enzyme levels, which can indicate damage resulting from the disease, or for certain autoantibodies, which cause the symptoms of polymyositis. MRIs are tests performed by a scanner using radio waves and a magnetic field to create 3D muscle imagery. MRIs can isolate areas of the body where antibodies are present and where damage has occurred. Electromyography is a procedure that records the electrical activity in muscles by inserting a thin needle electrode into the skin. Doctors can determine the presence of muscle disorders based on patterns of electrical activity as the patient flexes and relaxes their muscles. Lastly, muscle biopsies are used to test samples of specific muscle tissues precisely and reliably for inflammation. A small piece of tissue is surgically removed from a patient and then sent to a laboratory, where it is screened for deficiencies in certain proteins or enzymes, damage to the muscle, or other abnormalities. While there is no cure for polymyositis, there are many methods of mitigating its symptoms. Corticosteroids are often used in high doses to reduce inflammation in the muscle, and immunosuppressive drugs are used to treat patients that may not respond to corticosteroids. In severe cases of polymyositis, intravenous immunoglobulin can also be used to provide healthy antibodies for patients, which then block harmful antibodies from targeting friendly tissue. When it comes to lifestyle changes, the biggest recommendation given to those with polymyositis is to attend physical therapy to help their muscles continue to function properly. Speech therapy and dietetic assessment can also be recommended to those who have difficulty swallowing and/or talking due to their condition. Dietetic assessment would allow patients to learn of simple recipes that are easy to eat. While polymyositis can be a very difficult condition to manage, you can help patients by spreading awareness and supporting organizations that carry out scientific research, such as the American Autoimmune Related Diseases Association, the Autoimmunity Research Foundation, and the Global Autoimmune Institute, all listed in our description. Make sure to give us a like and subscribe to our channel if you enjoy learning about all things biomed. Thanks for watching!